So it's really important for both our teeth and our gums that we clean them every day. Ideally twice a day, but sometimes that's not always the case. So once a day is perfectly fine. Preferably also at bedtime as well. We want to clear as much bacteria as we can before we go to sleep. When we go to sleep, we don't have as much saliva in our mouth, and the plaque tends to sit on the tissues and the teeth, and it's a little bit more aggressive at night time than it is during the day. So if we can get a really good brush before bedtime, that's a really good start. Now in terms of brushing, we just want to make sure, I've just got my little teeth model here, that where we aim our toothbrush bristles is actually just between where the tooth and the gum meet. So it's literally just like a little pocket. So when you have your toothbrush, you just want to make sure that you're aiming it at the gum margin there. If we have it straight across, we tend to miss that area where all the plaque builds up. So you just want to make sure you've got it on an angle, and you just want to disrupt that plaque somehow. There's a lot of specific techniques that we're taught, but we're just about getting in there and just being very gentle and just removing the plaque. You just need a soft toothbrush. You don't need anything hard. Plaque's really soft to get rid of, and you just want to gently massage and jiggle off that plaque sitting there. In my PDF, I talk a lot about, what surfaces need to be cleaned, but obviously just getting in there and getting as much done as you can is the best option with children sometimes. And even using a pea-sized amount of toothpaste, getting some fluoride in the mouth as well is a really good protective factor. And the more you persist with it, the more that they may let you brush in time. You don't give up. You just have to keep going. We shower every day, we clean ourselves every day, so the mouth is an essential area as well that needs to be looked after. So we really try and encourage that with brushing. It's something that we don't give up, because if we let things get too far in our mouths, we can get quite a lot of painful conditions in our mouth. So we just want to make sure that we're on top of keeping the mouth as healthy as we can, because prevention is better than cure. Also, as well as toothbrushing, although it's fantastic, it doesn't always get in between the teeth. So we do always encourage people to try use some interdental aids, and there is so much out there. There's not just floss, there's lots of things on the market. So a couple of things I'll just show you are these little brushes. So you can buy them at the chemist. There's a huge range of oral products. These brushes are excellent. They come in different sizes, and all you need to do is just massage them very gently between the teeth. So you don't need to force them in between the gaps, but you can gently place them through, and they all come in different sizes. So you're better off starting off with a smaller size rather than a bigger size. And also we have these little flossettes, it's floss on a handle. So they just go in between the teeth, which is sometimes easier for kids to use or for carers to use as well. So you can just buy those at the chemist also. People also don't need to be limited to thinking, oh, I just need to brush in the bathroom. I'm not sure where you'll be going to see some of these families, but if you go to their house, you can look at what their setup is, what they have in the bathroom to brush their teeth. Are their toothbrushes old and things like that? Do they have a fluoride toothpaste and those sorts of things? So you can just have a look and maybe come up with some suggestions. You can brush children's teeth in their room, in their bed, or in the shower. You can have a toothbrush in the shower, it's perfectly fine. If, the child is restricted to a wheelchair or something like that, the carer can brush for them. The carer just needs to stand behind them. So, whatever approach works. And that's why it is good to go to a dental health professional, because they will help with techniques that can assist with brushing. But yes, like I've said before, we encourage not to give up, to keep trying, and there's plenty of products out there. There's even mouthwashes as well that can help as an adjunct to toothbrushing if we can't get in there. So have a look at the PDF, and there's a few more handy hints in there to help brushing at home.